afternoon, and thank you for joining us for this afternoon's virtual media briefing on COVID-19 in London and Middlesex County. We're glad to have you along with us. Also happy to be joined today by the Mayor of London, Ed Holder, the Warden of Middlesex County, Cathy Burghardt-Jesson, and the Medical Officer of Health at the Middlesex-London Health Unit, Dr. Chris Mackie. A welcome to media in attendance and a reminder that when you do submit your questions here on Microsoft Teams, please indicate your name, your media outlet, and who your question is for. And finally, a welcome to those tuning in this afternoon on Rogers Television, the Rogers Facebook page and YouTube channel, listeners on Global News Radio, AM 980 CFPL, and those who are listening and watching on the CTV London website. Let's begin with our opening remarks, and we'll start today, as we usually do, with Mayor Ed Holder.
Well, thank you, Dan, and good afternoon, everyone. As this is the last media briefing until our following week, I'd like to wish all those who celebrate a Blessed Orthodox Easter this coming Saturday. Look, we're confident that next year's occasion will see a return to the large and larger family gatherings that so many in our community value so deeply. But in the meantime, of course, that's just not possible. And how soon all of us can return to those kinds of get-togethers really does depend on how we do over the next number of weeks. Not only does that include following the public health protocols and guidelines, it also involves getting the first vaccine that's available to you. You'll note in our last session, one of the things that we talked about were for those who are eligible to ensure that they get their shots, because we still have too many people in senior ages who have not yet gotten their shot, and we're quite concerned about that. And just as the vast majority of Londoners have done what's been asked of them when it comes to COVID protocols, we're seeing a pretty good uptake locally for vaccines. And we're expected to top 160,000 doses administered at some point today, and that pace will only accelerate into May and beyond. We also learned today that on recommendation by Ontario's COVID-19 Science Advisory Table, that the government will be allocating 50% of its vaccine supply to hotspots for a 2-week period. So what does that mean for London and Middlesex? Well, according to the provincial government, that what it means is it's because of an overall increase in vaccine supply that we will continue receiving the same amount we've been receiving recently. Essentially, what has happened, though, is that our surge in vaccine will be pushed back 2 weeks later than it would have otherwise occurred. And while I know I could speak for the Warden to say that we would have preferred our surge to begin sooner, the fact our existing supplies will be maintained during this 2-week blitz of hotspots is welcome news, and I believe a reasonable compromise. Because the fact is, we only need to look at the number of people from out of town currently being cared for in our local ICU to realize that hotspots, wherever they are, have an impact on us here in London. Look at our emergency rooms as well. Unless or until some of the hardest hit regions are brought under control, then other communities like ours will continue to feel the effects. So here, I'd like to share some extremely optimistic news. In less than 1 month, the province of Ontario is anticipating that everyone over the age of 18 in our province will be eligible to receive a vaccine. And from my perspective, with this forecast, it appears we're finally in the home stretch. I used to argue that there was light at the end of the tunnel, but my complaint was I couldn't even see the tunnel. Well, it looks like it's starting to come together. So here, let me continue this weird analogy along a little bit more, because really what I'd like us all to do is to sprint to the finish line. Don't let up, just bear down. Over to you, Warden Cathy, please.
Great. Well, thank you very much for those words, Mayor Ed. And it's great to be with all of you on this dreary Thursday. But as I look out the window, I'm thinking I'm not sure any of you are likely in the mood for another rallying call, or we're all in this together, we've got this, we're just about there from a municipal leader. To be honest, I'm not sure I have it in me today. As I've said a few times the last month, it just seems that the weight of COVID is really being felt by all of us. As the mayor just said, we are all connected, and it's important to remember that what happens in other areas, in hotspots, does affect us here in Middlesex-London. And so we have to look at the solution that we're all part of this. We're all partners. We all have a role to play. I've seen firsthand this week the ripple effects of a healthcare system that is stretched to the brink because of COVID. And it comes at a cost to those in need of a healthcare system that are fighting battles outside of COVID. I have a family member who has many health challenges, and his regular checkups and tests have been consistently put off for a year or moved to a virtual platform. This week, our family found out that he is in crisis, and now emergency intervention is required. Had he been monitored as he was regularly prior to COVID, crisis likely could have been averted. So why am I sharing this with you? To once again remind you that we are all affected by COVID in some way or another, and we all have a role to play. We can all be armchair quarterbacks, or we can all be first-string players. There will be plenty of time to dissect what has been done or what hasn't been done, what could have been done better, what was done terrifically. And I can assure you, I will be part of the debrief and the lessons learned discussion when we get to the end of that tunnel. But until then, let's get through this as best we can. Let's lift those up who are on the front lines, whether they're healthcare workers or grocery store clerks, truck drivers, those working in our COVID testing centers or our vaccinators. Let's celebrate the good that is still out there. Support local where you can, and if you are able, treat your family to take out once a week. Buy a gift certificate for personal services. Look out for your neighbor. And as always, be physically distant, wash your hands, get tested if you show symptoms, stay home if you are ill, mask up if you are eligible. And when you become eligible, make sure you book that all-important appointment to get vaccinated. Dr. Mackie.
Thank you very much, Mayor Holder and Warden Burghardt-Jesson. Well, here we are. We are continuing to see intense spread of COVID in our community. Roughly 100 cases, just over 100 cases per day on average over the past week or so. That is, really close to where we have been in terms of peak spread of COVID. And we know that our testing numbers are down a bit as they are across the province. So there's no doubt we're at peak COVID spread levels, and we absolutely need to do everything possible to protect each other and stay safe. The vaccine story is the major positive right now. Over the past week, the 3 mass immunization clinics in London and Middlesex have vaccinated 23,240 people. That's an average of over 3,000 per day. We'll see a little bit of a dip next week, but really accelerating in the weeks after that. So that is very exciting. And as you heard the mayor refer to earlier, the province has laid out an aggressive timetable to open vaccinations over the next few weeks sequentially to everyone who is an adult and eligible by May 24th. So within less than 1 month, we'll see eligibility open to all adults in this region. The provincial timetable is aggressive. We believe we'll be able to more or less keep pace here in Middlesex and London within a couple of days. In particular, we will be opening up to everyone age 55 and over tomorrow morning at 8 a.m. in alignment with the provincial move in that direction. And that is a decision we've made with the direction of the province, but also consultation with our partners here in Perth and Southwestern Public Health, as well as our partners at London Health Science Centre. We're very happy to be able to make that move. We hope to be able to open very soon as well to 50 plus. And as you heard mentioned, to that first group of employees who can't work from home at some point next week. We don't have a date on that, but we will do our best to make that happen next week as well. I'm sure there are lots of questions then. I'm going to pause right there. Happy to help answer.
Thank you very much, Dr. Mackie, Madam Warden, and Mr. Mayor. And yes, on a gloomy Thursday afternoon, certainly a lot of very good news to kick off today's briefing. Let's go to those questions right away. Jennifer Beeman is first in line today, Dr. Mackie, and she has a question for you. The province's vaccine briefing today said the first round of the Can't Work From Home group will become eligible to book appointments next week. Will that be the case in Middlesex-London?
Jen, I'm going to go ahead and say that will be the case. I don't know what day next week. We will be booking intensely to get 55 plus and then 50 plus once that opens up, all booked. But we're going to do everything possible to make sure that at some point next week we can start booking that first group of employees who can't work from home.
Thank you very much. And let's move to Jen's next question, a follow-up from her. The province will be moving 50% of its doses to hotspots next week and the week after, but at the same time is expecting almost double its usual allocation. Are you still expecting our usual 12,800 or so Pfizer dose shipment next week and for the following week?
We sure are, Jen. That's exactly what we're expecting this week and next week.
All right. And just looking at the questions here, Dr. Mackie, what % of our adult population has received at least one vaccine dose? How about the percentage of our overall population in Middlesex-London?
We're in the ballpark, Jen, of about 30 to 35% vaccinating intensely this week. And we hope to be able to meet the provincial goal of 40% of adults vaccinated by May 1st. We don't have perfect visibility there. I mentioned the doses that we're vaccinating in the mass clinics. We also know about the Family Doc 5,700 doses, which of AstraZeneca that were allocated here and which will be administered by the end of this week through Family Doc clinics. There are 21,000 or so doses through the pharmacies, and we don't have great visibility into how that is going. We know that pharmacies are vaccinating as quickly as possible, and that is definitely happening. We don't have a quantitative measure there. The one sort of caveat there is that some of those doses that we've been administering are going to second doses for the very small group that is eligible for that. And we also are vaccinating some people from outside of the region. That's been historical because of our strong partnerships across the region. People go where it's most convenient for them, not necessarily to the place where they happen to live or work. And so that affects some of that actual percentage, but it's in the range of 30 to 35% now. It'll be in the range of 35, 40% by the end of this month. And then we will keep on charging forward from there.
Thank you, Dr. Mackie. And I know Jen has seen it, but for those members of the media who maybe haven't, the percent of Middlesex-London health unit residents who have been vaccinated with at least one dose by age group has been added to the dashboard that is available every day online. Just click on the vaccination tab. The next question is from Jane Sims at the London Free Press. Dr. Mackie, this one is for you as well. With the government's announcement today about opening up the age bands, how soon will the Nichols mass vaccination site be open? Is there any chance, given the number of people over the age of 40 seeking the Oxford AstraZeneca shots, that the age bands will move any quicker for Moderna and for Pfizer?
I think you're bang on there, Jen. We do expect the next few age bands to move a bit quicker. We also have, especially mid-May and onward, accelerating availability of Pfizer, which will really help move that quickly as well. At this point, we are planning to open Nichols in the month of May, and stay tuned. We'll announce a date as soon as we have that finalized.
Thank you very much. And let's go to a follow-up from Jane Sims. Dr. Mackie, have you received any information about if and when MLHU will be getting Johnson & Johnson vaccine?
No, what we've been told is that the federal government has a J&J allocation, and the provincial government doesn't have how that allocation will be doled out to the provinces yet. So we haven't got that at the local level either.
We forget maybe a little bit about how fast things are moving. Today was the first day that childcare staff in licensed childcare settings are now eligible to book appointments and get vaccinated. So the next question is from Andrew Graham at Global News Radio, AM 980 CFPL, and that's what his question is about, Dr. Mackie. Have all licensed childcare settings in the region received their letter, which they need to send their employees in order to get vaccinated? Have there been any delays in expanding that eligibility locally?
We haven't really seen delays. So the process there has been a pre-registration process. We've had most licensed childcare submit their requests long before this opened up so that we were ready to hit the ground running and send them the booking token information as soon as this opened up. So as far as we know, that's moving smoothly. Of course, we wish that we had enough vaccine to offer to unlicensed childcare as well. So that obviously is a pain point for many, but everyone will be vaccinated, eligible soon. So that hopefully will cover the rest of that group.
Another question from Andrew Graham, Mayor Holder, Warden Burghardt-Jesson. This one is for both of you. So to the Mayor and the Warden, what is your reaction to news of vaccines being diverted to hotspots? Are you concerned for how this might affect our region? Madam Warden, would you like to go first, and then we'll come to the Mayor?
Sure, thanks, Dan, and thanks for the question, Andrew. I think initially there was a lot of concern. The Mayor mentioned it earlier in his opening remarks about exactly how diverting the vaccine would affect the Middlesex-London region. And I know that we both lobbied our local provincial elected officials to say keep the vaccine train running into our area. That being said, I think we've all said from the beginning that this really is a partnership in this fight. And if we have neighboring communities that are hotspots, that are struggling, we have to be able to support them where we can. I think that the plan going forward is a good compromise, and I don't see that there will be a lot of effect to our region. So I'm supportive of how the province has decided to deal with this. Over to you, Ed.
Oh, you're on mute, Mr. Mayor.
Thanks very much, and thanks, Andrew, for the query. In my comments today, the concern we always had is that somehow London and Middlesex were going to be disadvantaged regionally when, in fact, N6A for a period of time was the worst hotspot in all of Ontario, and we're terrifically concerned. Those hotspots may tend to ebb and flow, but I will tell you, not in GTA. So one of the assurances that we've received from the minister has been that we will have the vaccine supplies maintained at current levels, notwithstanding this week. And we anticipate a surge, and you've heard Dr. Mackie talk a bit about that going forward. So as a result of that, I've always been of the view that when the province had the vaccines, they would be distributed equitably. And my sense is that's happening. I would also say that if we don't take care of the worst spots in the province, then one of the challenges that we know is will have an impact on every one of us in the province. So we need to bring those regions absolutely under control. Otherwise, London and Middlesex will feel the impacts of that. So, fingers crossed, shots in arms, folks. Let's get this done together. And that's why, even with the opening up of vaccine to ages 18 and up, can I say all the more reason that the older folks who have not yet had their shots get it done, because the potential for risk is too high, and we want everyone to be able to enjoy their kids and grandkids. That's it for me. Thanks.
Thank you, Mr. Mayor. Thank you, Madam Warden. The next question is from Jane Sims. It's for Dr. Mackie. Dr. Mackie, with the flood of vaccine coming in, do you anticipate that second doses will be fast-tracked and given sooner than the current 4-month interval between doses?
Yeah, thanks for the question. We don't anticipate a major change in direction around second doses in the time period that we're looking at, through May into June. We will be starting second doses for really the ramp up population in sort of mid-May. That will be a relatively small part of the campaign because the numbers 4 months ago were that much smaller. We essentially, the reason for the 4-month delay is to get as many first doses in arms as possible and then to start on second doses. And so we won't have first doses all in the arms until likely sometime, at this point, we're looking at late June, maybe early July. And so that just means that the people that have been latest in receiving their first doses are likely to see their second doses sooner, mainly because the supply will be available then. But those that have been already delayed out to 4 months will not see their second doses change in time.
Next question comes to us from Andrew Graham and Dr. Mackie. This one is for you as well. And again, things are moving very, very quickly today. So Andrew would like to know, is the at-risk population still being considered for a potential eligibility expansion for local vaccinations?
Yeah, thanks, Andrew. So if you had a chance to look at the provincial deck that presented the projected timelines, the at-risk health conditions are now projected in the provincial scheduling for the week of May 10th. Doesn't mean on May 10th, it means the week of. And that's a huge group that opens at the same time as the second group of people who can't work from home, as well as the age band from 40 to 50. So that'll be a challenging week from the perspective of opening up to all of those three huge groups all at once. So, that's a projection at this point. We'll wait until the actual announcement before confirming. But at this point, that's what the province has projected, and we're going to do our best to try and meet that as long as we're able to with vaccine supply.
Thank you very much, Dr. Mackie. And if you, as a member of the media joining us this afternoon, have a question, we are going to finish right at 2:30 today, but it looks like we might have time for one or maybe two more questions. So if you want to get those in, now would be the time. Jennifer Beeman has another question, Dr. Mackie. When these new groups become eligible to book appointments, how many weeks out will these appointments generally be?
Yeah, it's in the range of 1 to 3 weeks out, and it really depends on how many people we're opening to and how many have spots have become open in the system. As we look forward to tomorrow morning opening to the 55 to 60 age group, we have about 19,000 appointments across the whole system right now over the next 4 weeks that are available. That means we should be able to book that group fairly quickly and then open up to the 50 to 55 age group, hopefully early next week. And what we, the question as to, if you're looking at the following week, the May 10th, where you've got potentially the 45 to 50, maybe the 40 to 50 age group, as well as a second group of people who can't work from home, as well as the at-risk health conditions, that's where you would probably start to see pressure points where we wouldn't have large numbers of appointments available. We may have to try and schedule people out into, a fifth week at that point. So it really depends, but at the moment, we have spots available in the 1 to 3 weeks horizon.
Thank you very much, Dr. Mackie. And that does bring us to the end of our question queue for this afternoon. Thank you to the three of you for your time and for your insights and your information this afternoon. I know it's always very, very much appreciated. And thank you for joining us as well. We will be back with our next virtual media briefing on Monday afternoon at 2 o'clock. We hope you'll be able to join us. So between now and then, have a great rest of your day. Enjoy the weekend. We'll see you on Monday. And so long for now.